Welcome to Behind the Best, the podcast by Fortius Clinic, where we go behind the best in sport and performance. So today's episode is something that affects every woman who moves her body, whether that's through sport, exercise, or just everyday life. At Fortius Clinic and beyond, we see time and time again the impact of women being assessed using research that wasn't actually designed for them. So today I'm joined by Jo Larkin, consultant in sport and exercise medicine, to unpack what that means in real terms and how better understanding can lead to better outcomes. So we're going to look at the bigger picture today. This is where we're going to start. Why the female body is not a smaller male body and what happens when we treat it as if it is. So let's just go straight into it. Why has female physiology historically been underrepresented in sport and exercise research?
Well, thanks first for having me on the podcast. So for me, I think that's quite a multifactorial answer, but the reality is women have a set of hormones that dance every month, and we are not easy to follow or investigate because it creates too many variables. So when scientists want to look at research, they want to control the variables. And I suppose if you were to look at the male hormone pattern, it is quite linear. I'm oversimplifying, but overall, testosterone has an effect at a certain level. Whereas if you were to take a woman on day 1 of her cycle versus day 14, the levels of estrogen, progesterone, FSH, LH, all of these hormones that I've just mentioned, way more than the men's, have different parts of highs and lows. And so that creates a variability. I think also the complexities of, I suppose, where the money comes from, depending if we're looking in the elite setting. Men generally are the people that have more funding and create money for the sport, and hence the money and investigations go into that avenue. And whereas within the women, until you give them the opportunity to grow the sport, it's very hard to then create your own financial stability. And so they quite often piggyback off the men's game to create the opportunity for the women. But I would think, generally speaking, in the, I suppose, more medical sense of the word, it's the controlling the variables.
Okay, so then that's very interesting. And then with all of that in mind, what is the most important biological differences then that affect training, recovery, and performance?
I mean, I think overall, when I suppose children are children, before puberty kicks in, everything's quite similar. So hormones are similar, body shape, growth, everything. And then as soon as the testosterone kicks in for the men, well, that's when they get more muscle mass and bone growth. And with the women, that's when we start to see body changes. And so understanding your cycle is really important. But the reality is for a woman, their cycle evolves also over time. And so for me, the kind of key elements of, I suppose, understanding your own body is to listen to it and then think about how to train by listening to your body. So I see a lot of women at Fortius clinics coming in who are trying to balance a full-time, career, being the mum at home and then squeezing in some form of training for the next big event that they're doing. And they're constantly putting themselves in a stress mode, which is like a fight and flight. So therefore prohibiting actually the benefit of the exercise they're doing to get that recovery, but also putting themselves constantly in a kind of stress position. So they're not going to be sleeping as well and so forth. So for me, kind of the development of a training program needs to fit into your own individual life, where you are in your stage of life. And you also need to adapt depending on how you've responded to the last 24, 48 hours, rather than just going, I've signed up to a class and I need to do it because otherwise I lose my credit, which is where I think some of the exercise industry is quite a challenge because people don't want to lose money, but equally maybe that high intensity class wasn't the right thing for them to do that day and it might have been more of an active recovery.
Okay, we're definitely going to get into this more, especially with regards to exercising and recovery and stress. But then how early did these differences start to matter then for people?
Yeah, I mean, I would say definitely the differences between the male and female population really start to, I suppose, branch away from each other at the point of puberty. And that is seen even just within the take-up of women in sport. So men generally, their bones, they grow, their muscle mass increases, whereas the woman actually changes their physical shape, their hips widen, and also they start to store, fat that's required for, it's essential for life. And so women then start to move differently because they're having to adapt to their body type. And also some of them become quite self-conscious. So I know many a female that really enjoy playing football up until they develop breasts because they then want to chest a ball, or they were different from the person that was a bit of a late bloomer and hence they could chest a ball. And so for me, I think those differences in body awareness start as soon as puberty happens. But then I think we've also got to try and normalise that for girls to keep the uptake, because the better we do at that influential age, I suppose, the more likely then we'll have a better training programme for women that's beneficial to all parts of life. And then I suppose the other key part where the differences happen again for a woman is that perimenopausal, menopausal part. So when the estrogen starts to drop off, their protective elements around their bones and muscle also start to drop off. And therefore, we really do need to keep women being active. And at that point, they should definitely be doing some strength training as well.
It's so interesting because as women, obviously, especially when we're in school and we're teenagers or younger, we go through specific lessons, I'm sure we all have as women at school. But these things we're not ever really taught about. We're not actually taught about how it really can affect our bodies in everyday life, in sport, even in recovery. And even I'm learning so much already in the last, however long we've been sitting here. And it's really interesting because we're not taught about these kind of things, and we're not taught about how it can affect us in our every single day. And how we don't learn how these changes in our bodies can affect us, and how we perceive them, and how they change us and identify us as women.
And look, the female hormones are amazing. It's our superpower. We've got variability. We can conceive, we can carry a baby. And actually there are so many positives at different parts of the cycle where, for example, your estrogen is so good for your muscles that if you are in that part of the cycle where there's a surge, then you should be doing some more of the strength training. Equally, progesterone increases your heart rate and your body temperature. So that might be a reason for why a woman might say, God, last week my 5K felt really easy, but this week it feels really hard. And instead of kind of beating themselves up and thinking, I need to train harder, they just need to be aware that there is stuff going on that might be also playing a part in this. And I think that's really important. But I also think, having worked with elite athletes, we don't talk about, we are actually, that's like, we are talking way more about the menstrual cycle now and understanding the individual impact of it. But I worked in several sports where women had to wear white for competition on the international stage. You've got a heavy period and you're someone that is unfortunate to not be able to control it with like regular means. Guess what? You're going to already be going onto that field of play in a negative headspace, thinking about, oh my gosh, I'm really embarrassed. What happens? And so for us, it's really important to talk about it, normalize it, but also find ways of helping to support the individual so that if you are, for example, getting to the final in Wimbledon and you know that hormones affect you, there's also an element of going, but I need to also rise above that. I don't want to have a negative impact from it as well. So it's making sure there's awareness, education, adaptation in the training element, but also making sure that when they do, the individual needs to perform, then we also have the support network around them for that as well.
So what do you then wish more people understood about the female body emotion?
It's really interesting because if I look at my patients that I see in clinic at Fortius, then I would say most of them who I'm seeing are active women who are probably in a perpetual energy deficit, have been their whole life because they think they have to be a certain size and shape. And a lot of women start to be influenced by individuals to kind of do maybe some intermittent fasting while increasing their energy output, and they start to develop some niggles and not really understand there is a menu of what you need to do for your body to be in a good performance element. But also I think there's a lot of negativity for women when they don't perform, that they think it's them doing something wrong, when actually it's about the understanding of the contributing factors to it. So I think for me, open dialogues around the importance of energy and fueling, importance of timing your training appropriately, but also I quite often talk about the kind of credit debit system, but not in an energy calorie point of view. I think that's wrong. I talk about it in the kind of the foundations of what you should be doing for the activity and meeting the demands. And so running, for example, is quite a high demand exercise for the body, really accessible. You want people to be able to do it. But if you run every single day and don't allow your body to recover, then you're at risk of injury. So we need to be putting mobility in there. We need to be putting strength and active recovery and kind of crediting the body. So every time that you do a run, yes, you take a debit, but you're not in a deficit. And that concept is quite an important one, because I think some people have these goals around how they aesthetically want to look. And actually, what I want women to be doing is thinking about how their body can keep them active for the rest of their life, and they can be strong and independent, and all of those really important factors of why we do exercise, let alone the highs that you get from doing exercise, from the endorphin rush and everything else.
Definitely. And also with regards to stress, when people, or whenever you're feeling a very specific way, how exercise can make you feel.
Oh, completely.
And then is this something that you regularly see reflected in women coming into Fortius for care then?
Oh, completely. I mean, I would say there's several factors. Probably I've done quite a few talks around relative energy deficiency, but also the female hormones and just bodies in general, how we train differently to men at different parts of the cycle. But I also think women like to talk about to a woman sometimes. And so maybe I see more women because of that reason. I haven't analysed my data, but there might be that. But I also think when someone comes in to see me, regardless of what injury, I look at all the contributing factors. And so a consultation, even if you're coming in for your, say, for example, Achilles tendon, we'll obviously talk about the Achilles tendon, but we'll talk about the biomechanics, the movement mechanics, the training volume. But I will also, if they're female, talk about their hormones, their energy balance, their periods, their menstrual cycle, because it creates that whole picture as to why they might be a bit slower to recover, or why they are getting these niggles and finding it hard to feel 100% in their body. So I think because I do that and I give the time, then my referrers then refer more people to do that as well.
So now once we understand that women's bodies do respond differently to men, I want to move on to what relates to, what happens when those differences then aren't supported.
Yeah.
And particularly when it does come to energy and fueling, because we've mentioned this enough already, but fueling is a huge, huge part of, obviously for women as well, but a huge part of everything that they do. So we're going to talk about low energy availability and REDS, which I hadn't heard of until today. So I'm very intrigued to know all about this and why this isn't just an issue for elite, athletes. Because I wish I was one, but I'm not. So let's start with REDS. It's often discussed, like I said, in elite sport, but many women that are listening, like I said, they won't identify as elite athletes. So what is REDS in simple terms?
Okay, so it actually used to be called female athlete triad, which made it even more complicated because it was just related to females. It was to do with bone health, menstrual cycle, and essentially that kind of triad of being energy restricted. And then suddenly people realised there's a lot more to that. So when your body is underfueled, which was what relative energy deficiency is, it's a bit like your mobile phone when your battery's low. It turns off all the background apps so that you can do what you're asking it to do, i.e. make a call and tasks in hand. So i.e. right now, keep you alive to talk to me. And then if you wanted to go for a run, do the run. But it will then shut off all the background noise. So that will be bone health, that will be menstrual cycle, that will be things like your digestive system becomes more sluggish. So many people with REDS describe like a bloating or a feeling that their gut's not as good from a health perspective, but it also impacts your immunity. So things like recurrent illness. And so what tends to happen with RED-S is, sadly, within the clinic setting, people present because they've got a bone stress fracture. And by that point, that's a late finding. And then you delve into the history and they say, oh, I haven't had my periods for months on end, but I thought that was because I was training well. And that's what they say. It's good if you lose your periods. And it's quite not, it's the opposite. We need to say to people, losing your period is a sign. It's a vital sign of the body, a bit like the blood pressure and your temperature. Like if you lose your period, that's your body telling you, I haven't got enough to focus on right now. And so it's actually a big collection of symptoms and signs that kind of historically were just related to bone health and periods. And now we've realised it does happen in the male population, but in the women's population, obviously we have that vital sign I just alluded to, the menstrual cycle. But essentially I see it as a way of going, your body wants to keep you alive, it wants to do the task in hand. So the only way it can do that is turning off all the background noise. And that background noise is important stuff.
Yeah, no, it's interesting. And also, is this something then you would see being affected instantaneously, or could it be something more down the line?
It tends to be down the line. It's an accumulative element. So I think, ultimately by the time you've got what we call a metabolic injury where it's impacting your thyroid function and all those things, it's been a journey to get there. You'll have some athletes that will be teetering on the edge. So they'll say sometimes like, oh yeah, I missed my period for a couple of months and then it came back when I was injured and now I'm fine again. Well, that shows you there may not be an intentional energy deficit, i.e. they're restricting their intake, but clearly their output was greater. And so you have to work on understanding the kind of where the balance issue is. And so for some people in maybe more aesthetically driven sports, or where there's a weight restriction, it may be that there is some intentional elements around how they fuel. And then you've got other people that's your classic that come, I'm loath to say it's the classic, because obviously you can present with bone issues in lots of different formats, but this is that time of year now when the London Marathon's coming up, and your novice runner is probably fueling exactly the same way despite their mileage going up. And so the body then over time isn't having enough energy to help adapt the bone stresses that it's experiencing. So RED-S is in the general population. It doesn't mean it's always intentional. And I think a lot of people hear that and think, oh, eating disorder. That's not the case. It's understanding it's a complex set of signs and symptoms that, sadly, for me, sometimes present too late. They've already got the injury and I'm breaking the bad news that I'm really sorry you can't run the marathon this year because you've broken your bone in your foot or your shin. But hopefully with more awareness, people will be a bit more proactive with the niggles that they feel, because that's one of the presenting complaints, if you look at the early signs, is those kind of, I'm not recovering the same way as I used to. I've got all these niggles. I'm not sure why that is. And so I would say seeing someone sooner to have that full package of review will be hopefully beneficial from an educational purpose, but hopefully also to prevent injury in the future.
I remember when I was training for the London Landmarks half marathon, I've only done half. I'm only doing half. But I remember I kept saying to myself, I can eat way more and I can have loads more, because it was constant running. And I remember even people telling me to make sure I was eating more, especially more carbohydrates, I think at the time, because they were like, you don't realize how much you're running.
Oh, completely. And also what the energy expenditure after the exercise is as well. So a lot of people, do an exercise and don't realize then their basal metabolic rate is then altered thereafter for a period of time. So again, I don't want people to become calorie counters, because that could be detrimental. But what is really important is if you are doing more, your body needs more. And it's also about the timing as well. So someone might say to you, they eat quite well, but actually if they're not refueling after the exercise, then ultimately their body's going to look for other sources to kind of recover from the training that they've just done, rather than actually using the right nutrition.
So who is most at risk with RED-S?
I mean, it is still females, and I think there's lots of reasons for that. I think, like I said, there's a lot of women in this life who have been on a perpetual diet first and foremost, and then what ends up happening around the perimenopause, menopausal period is a woman can no longer identify with their body. They feel like they're gaining weight, and so this is when they start to do some more extreme kind of options to maybe get on top of the control of the weight. But what they don't realize is, yes, you might lose some weight at the beginning, but your body then will go into I'm not sure when my next meal is coming. So therefore it goes into a storage mode. And quite often when someone comes to see me, I'll do bloods for that reason, to look at just basic markers to check if they're in a deficiency of like any deficits of nutrients. But interestingly, one of the signs of RED-S is also raised cholesterol. And if you go to a regular doctor who doesn't know about RED-S, they'll say, oh, you need to eat less and exercise more. And that's quite the opposite. Actually, your body is storing the cholesterol because it doesn't know when the next meal is coming, and it's starting to hold it on. And what you need, your body likes rhythm. And if you're out of rhythm, then ultimately it doesn't, it doesn't respond well. It goes into a kind of survival mode. I think with men, they are at risk, and there's definitely some very good evidence to show men are becoming more aware of like being low percentage fat, just to be able to be shredded. We even use the term shred in the male sector. We don't talk about that in the female sector. So the language is different. And I am seeing people in that industry that are not recovering from their soft tissue injuries like tendinopathies and or bone health issues, but it is still a lot less than the female population.
So why is it underdiagnosed still?
I mean, I think there's lots of reasons for this, but when you look at the collection of initial symptoms like feeling fatigued, brain fog, low in energy, all of these symptoms when you go to your general practitioner might be dealt with in isolation rather than thinking more holistically about the kind of different contributing factors. There's also, again, looking at that population, the perimenopause, menopause area, where it is unbelievably great that we are now talking about it. but we're also doing ourselves a disservice not to rule out all the other reasons that you might feel that way. And so a woman will now go to their GP potentially and say, I'm, 45, I've got brain fog, I feel a bit I'm aching everywhere. And they sort of suggest HRT, which may be appropriate, but I still believe it should be an option after excluding other things. So, for example, if you are overtraining and underfueling, you may be deficient in ferritin, folate, iron. You might not be anemic, but your stools will be low. And so you correct those elements, and guess what? Lots of those, when they're treated either with a food-first approach or supplements, suddenly you feel better. And so for me, it's going, yes, HRT definitely has a role for some women, if not a lot of women. But I think we need to also rule out those other reasons and not just treat them in boxes of isolation and think, well, let's listen to this person. And the nature of obviously a consultation with a general practitioner is much shorter, so they only can deal with what's in front of them. And I hope that's why people might want to kind of come and see someone that's got a specialist who can give them more time to go through all of it. But things like this podcast will hopefully spread a bit more awareness as well.
Well, it's definitely already doing things to my mind. I'm sitting here just like, I'm like not judging myself, but I'm like sitting here thinking about, like I said, I train a lot.
Yeah.
So I'm sitting here just really reflecting while you're talking. And it's fascinating because even when you talk about things like looking at things separately, but actually rather than thinking about different things separately, putting it all together and thinking, well, what is it? Is it just one thing?
Yeah.
So then what early warning signs are commonly missed then?
Yeah, I think some of the ones I just covered there, people feel they get a little bit more niggles. They're not recovering as quickly as they used to, maybe even some brain fog, like I mentioned. Certainly also sometimes disturbed sleep, which again goes with like the perimenopausal, menopausal area. And then I'd say recurrent illnesses as well. So if you feel like, for example, you're getting lots of coughs, colds, sniffles compared to the rest of your peers, you might be not having enough energy to recover, and your immunity is sort of getting impacted by that.
So then why do so many women normalize symptoms like fatigue or missed periods? I know obviously fatigue is a big one, but why do we? I'm going to say we. Why do we?
Yeah, I mean, I think that's a huge question that I have to be, but I feel like women are trying to level up in a very male-dominated world. And like if you do, sit in a meeting and you're feeling, God, like I'm cramping and I feel really uncomfortable, God forbid you'd be able to speak up sometimes and say, I just need to leave the room. You'd feel like you're, a lesser person on that platform with everyone else. And I think education of men about what we go through is really important, and I also think we also have to not do ourselves a disservice. I think we're very quick to put ourselves down. And also when you're underfueling, by the way, you can become a little bit more anxious and a bit more negative about yourself. So then that impacts the situation even more. But I think we've got to realise we're doing an amazing job. And a lot of what I do in kind of my elite setting is making sure that women get the same care as them. I've worked in male and female settings, and I just want the women to get the same as what the men get. I'm not on this crusade to do anything more than that. And I think that's the same in the work setting. We should be able to have equality, but also be able to say we are different. And actually there are things sometimes where we might not be able to deliver the same way, but I promise you we'll work extra hard the next day to compensate for it. But that's the problem. We then play a catch up and we want to be this super person. And actually sometimes we have to just be kind to ourselves and go, that just needs to be parked for today and I'll get on with it tomorrow.
I knew we were different, but I didn't realize how biologically really different we were. And I just want to quickly touch on something you just mentioned with regards to low fueling and negative self-talk.
Yeah.
Why does that correlate?
Probably because there's also a negative feedback about the outcome as well. So like you said previously, when you were training, if you didn't feel good about it, I bet you then went the next day and tried to go harder again rather than,
Yeah, probably.
And so what ends up happening is it becomes this vicious spiral or a circle of negativity. You don't perform as well, or you then feel like you need to do more work to compensate. And actually that's one of the things we see in the elite setting, performance dropping off despite training more. There are also, like, for example, when you're running a marathon, it's easier for your body when you're lighter quite often. But actually I would love to change that and say it's better for you if you're stronger because your body can tolerate it more. And so this concept of being lighter we see the marathon runners, we can see they're very lean and low body mass, but actually lots of them now who are beating the records and again are the ones that have embraced the strength element. And for me, strong legs are really important. We were talking about this before we started the podcast. And I think understanding that takes time and it is a marathon. And on every time you do a training block, it's not going to be 100% perfect. And also the other bit I think that's really interesting is lots of my patients train or have the mentality they want to train like an elite person, but have a full-time job. And yet an elite person wouldn't do that. All they have to think about is like, I get up and go to the training ground. Okay, I give someone else my details and food is prepared for them. And, so I think there's an element of truth that we've also got to balance the fact that we're sitting and working a full-time job as well. And I think the positive things about what's happened in probably the last decade is women want to be stronger. They're openly talking about it and they're seeing people train in the gym, lifting heavy or pushing heavy, and you aspire to be that. I also have still worked with athletes that go, I don't want to do weights because I don't want to bulk up. And I'm like, you have to do so much work to bulk up. Like, you are way off that journey of being, like, you can be strong and push a lot through your legs and still be, long and lean. Like, I think there's this myth that as soon as you lift a weight, you're like, I'm like, oh my gosh, do you realize how hard those people have got to?
I have to be honest with you, that myth is real because I was there at one point in my life. I was like, I don't want to go into the weight section. And people would say one, I was like, because I don't want to be all bulky. And they were like, Talia, you're not going to suddenly be bulky. They were like, also your build is not.
Exactly.
You won't turn into that. And I was like, I will if I train hard enough.
Exactly. And it just makes me laugh because I think, gosh, some of those people that really do want to do what you call the hypertrophy, the bulking training, it is so dedicated. And the amount they have to eat, the amount of like stimulus they have to do to get that, you're not going to walk out bulking from being the gym. But what you are going to do is feel better. You're going to move stronger and you're going to be able to tolerate more of what the demands of the sports are that you want to do. So for me, integrating strength is so important.
So then before we move on to the next section, what happens if low energy availability is ignored long term then?
Yeah, so sadly, for some people, there is the risk of infertility. So the longer you are what we call amenorrheic, so meaning no periods, the longer you're putting yourself in both a metabolic and hormonal injury. And the longer you are, the harder it is to recover. The bone health element, so when you are in your kind of adolescent puberty years, that's when most of your bone health and strength is developing. And so if you are in a deficit in those formative years, then you are putting you at risk of low density. Lots of people have heard of osteoporosis, but there's a thing called osteopenia, which is the journey towards it. And a lot of these things are hard to rectify if you are then constantly in a low availability. And then I alluded to some of it earlier on around the cholesterol element, but actually if you're in a low availability for longer, you have cardiac risk because of the fact that you have raised cholesterol. So it's actually, multi-systems, and of which, some of them are pretty serious things and also can impact. There's a lot of people training at a younger age that don't realize they could be doing things now to impact their future fertility and all this other thing, which I'm sure if you said at some point, do you want the option to maybe have a baby? Then we'd go, yes. And so I'm like, well, we need to do something about it now because there's no guarantees.
Yeah, this isn't discussed.
No.
Ever. This is realistically, there are a few things obviously I have spoken about with people today, but a lot of it I haven't. And I've been training I've been in the gym since I was 16.
Yeah.
It's just, I've enjoyed it.
Yeah.
But I didn't know any of this. Even back then. And I think people are training even younger. When I go into the gym now, there are people even younger than 16 in there.
Exactly.
I'm talking about females. And this is, it's just not discussed widely enough.
No. And it is important to have young, adolescents or children moving. Like, it's so important to get them to enjoy exercise at a young age because it shows that you're more likely to keep up exercise later. But again, it's about the type of listening to your body. And another time when I see injuries, both in males and females again, is when people are going through a growth spurt, not realizing that their body is prioritizing the bone health to grow. And so they're playing, they've gone their coordination goes off because their bones grow faster than the muscles. They then try and train harder because they feel more like they need to practice the coordination. But actually then what they're doing is overstressing the bone. And hence myself and many of my colleagues will see what's called a pars defect, which is a fracture of the spine because of the overload that someone's done at the wrong time. So it's also listening to the different changes that our body goes through to adapt the training.
It's just so
It's
much.
endless.
Yeah, it's
I could throw in another thing.
Yeah, you do. And I'm just like, I sit there and I think about it and I'm like, I'm in my 20s, just, I'm leaving it very soon.
Yeah.
And it's just, it is an endless cycle of just ever change.
Yeah. And then if you throw in the aging process, we know collagen turnover decrease. We just have to look in our, so I'm 45 and, my skin definitely doesn't look the same as when I was 18. And that our tendons are made up of similar, foundations of molecules of the collagen and elastin and so forth. So that adaptation may be a bit more sluggish in our later years, and respecting that is, a really important part of how you recover. And I think that's really important. Each decade we move through, we've got more challenges that throw up. And that's hence why the menu of movement, strength, and cardiovascular training is really important.
So then, if low energy availability and poor recovery are so common, the question becomes, what should women actually then be prioritizing? So I want to focus on fueling sleep and recovery and why they are the foundational for health and performance. And the first question I want to touch upon, you actually mentioned earlier, was intermittent fasting. And I've done it.
Yeah.
I've done it before, and I don't know if it was good or not for me. And I know so many people that do it.
Yeah.
I see it all the time, especially on social media now more than ever.
Yeah.
And so many people are talking about it. But then at Fortius, we're seeing a lot of women influenced by this trend of intermittent fasting. Yeah. So why can these approaches and similar ones actually be problematic for women?
So I think it's really important, again, going back to that original conversation at the beginning of the podcast, like what studies are there in women with intermittent fasting, and also what else are you doing in your week? So there are lots of benefits from intermittent fasting. I can't dispute that. There is a metabolic reset. There actually seems to be cell regeneration and so forth. But what we haven't done is A, studied the female response to it, and B, also if you are training, that's when the issue comes in. So I think, we've got to put it into context of what the person in front of us is doing as well. And for women that want to lose weight, it does work. But if they actually want to be healthy without injury risk, and they want to build strength, they want to build an ability to train for longer, it's really not compatible, because our body seems to, again, going back to the different hormonal responses, there are different kind of neuromodulators that are more sensitive in women. And so as soon as you go into a fasted mode, it doesn't have the same response as a man. So therefore, we suddenly go into this, well, I now can't guarantee that I should be prioritizing things like my menstrual cycle, my bone health, because I don't know what's happening next. So it kind of doesn't always have a benefit on all the systems. And I think also going back to the differences in our responses in men and women, we do have different thresholds when things kick in compared to the men. And so it's really important that if we are going to embrace certain things like this, you need to know what it does to the women, and don't presume that because it works in a man, it will work on you. And we definitely see, the classic, again, the intermittent fasting for weight loss, but then trying to train harder. Well, guess what? That equals energy deficit. And we've just talked about what that does.
No, and I think you hit the nail on the head there. It's just learning to love yourself for who you are, exactly for who you are, because whoever you're looking at online or whatever you're trying to compare yourself to as a woman, obviously I can speak on behalf of myself and women, every single one of our bodies are different. We even mentioned this before. Every single one of our bodies are different. What we go through is different. How our bodies regulate, our menstrual cycles, everything is so different. So, if we're comparing ourselves to someone online, or even we're comparing ourselves to a photograph we took last week.
I know, exactly.
I've done that.
Yeah.
I'm like, how do I look so different this week?
Yeah.
But I forget that, my body's going through loads of different things. And we as women, we're all built differently. So just because one woman looks a very specific way, even if you, starved yourself, let's say, or you didn't eat, your body may never still look like another woman's, because you're built differently.
No, exactly.
And I think that's also something really important to know is you have to, it's difficult, don't get me wrong, it's really difficult, but you have to learn to love who you are and every part of you.
And I think it's interesting because I think back into my tennis days, and, in the male top tier of athletes, you cannot tell me that Djokovic looks the same as Nadal, who looks the same as Federer, who moves the same. We're very happy to say you can be at the top of your game and have different body types, different strengths, different muscle mass. But when it comes to the women, they want we're meant to all be a similar way. And that's what we have to break the mode. We have to say, we need to train for our own individual needs and train clever, obviously, if you're at the elite level, to get the best out of your body. So, yeah, it is an interesting one, society.
Yeah, well, that's a different topic.
Exactly.
So how does inadequate fueling affect hormones, stress, and recovery?
Yeah, so essentially, if you're in a deficit, as I mentioned earlier on, your body switches off those hormones, the dance that I talked about. And so what will happen is you'll start to see subclinical sometimes, meaning not detectable on just a snapshot of an impact on your thyroid function. Your estrogen will drop off, your progesterone. And so what ends up happening is actually your body slowly closes off all these systems, and you're not necessarily always aware because, as I say, because it's subclinical, sometimes if you have a week where you are a little bit better with your fueling, then actually you might have your period, but then you have a period where you're teetering, where you're overtraining because a competition's coming up or something, and then you lose it again. And I think it's just a way of your body saying, I haven't got enough energy to do the basics.
It's just fascinating. It's fascinating how simple it really is, but
the body switches off the things that aren't what deemed essential for keeping you in that moment alive and doing the activity that you want.
So what risks come with combining restriction and heavy training?
Yeah, I mean, for me, what I see in clinic is obviously the injuries to the bone health, stress fractures, slow return to healing. Sometimes the bones actually don't heal. They're called non-union or delayed, We see slow recovery of the soft tissues like the tendon issues. We see, as I say, longer term issues related to actual bone health like osteoporosis, and then menstrual issues with fertility issues. And kind of, again, a lot of women, when they have issues with their periods or lose their period, sometimes they're put on the pill. That's not how to treat it. Like, you don't put someone on it's a false reassurance that they have this breakthrough bleed. And lots of women come to see me, oh yeah, I do have a period because I bleed every month. And I'm like, that's not a period. And why were you put on it? For contraception or skin? And they're like, no, I just wasn't having my period, so I was put on it. And actually we're masking things. So it's really important that we have these discussions, but they can present in all manner of ways.
So then are there certain life stages when women are particularly vulnerable?
Yeah, so I think that part where I talked about the puberty period, where, we kind of start to change body shape, fat distribution, our angles of our hips, like I said, change. So that is also one of the reasons why women are more likely to have an anterior cruciate ligament injury. I know there's a lot of talk around the hormones and the effects on ligaments, but also our angles mean we are slightly more at risk. And then that perimenopausal, menopausal, where the estrogen levels start to drop off because the estrogen is protective to muscle, bone, energy levels, brain function.
Yeah. No, I honestly, I really mean it. I'm seeing things very differently at the moment. And then looking at beyond nutrition, how important are sleep and stress when it comes to recovery?
So important. I mean, look, I see people in my clinic, particularly as, again, women who are trying to juggle or balance a million plates, whatever you want to say. And stress is constantly telling your body you're in a fight and flight. Stress can make you feel like you're running a marathon every week, And so we know cortisol levels increase. We also know cortisol levels then put on stomach fat or belly fat. And guess what the woman's trying to do? Train that off because they're changing their body shape. So actually stress is so important, and understanding that connection of the parasympathetic system to reduce that cortisol is so important. But sleep by far for me is like, it's such an important phase. It's when if you are not sleeping properly, you're not getting the recovery. Your body releases hormones that help with the regeneration, help with the adaptation to the training you've just done. But it also is just a reset. And if you're not sleeping, well, that's another reason to talk about it. And sometimes, again, going back to the underfueling, I had athletes that weren't sleeping well because they were waking up and they'd been like hungry. We then looked at their and we were like, no wonder. And then we started to address that by doing a slow release protein called casein before bed, like a little bit of a baby feed. And guess what? They slept better. And then suddenly all their other performance markers started to increase. So sleep is so important.
I've had that sometimes when, with not even an intentional reason, but I've gone to bed probably thinking, I'm hungry, but it's late, I'm not going to eat.
Yeah.
And I cannot sleep. I'll go have a bowl of cereal and I fall straight asleep.
Yeah. Exactly. It makes such a difference.
See, so, like I said, sometimes it's so easy. Just eat more.
Yeah.
So when women come to Fortius feeling stuck or exhausted, where should they start?
I mean, for me, we have such a great collection of practitioners here. I think, the surgeons are some of the best in the world, and the physicians, I hope I've demonstrated that physicians, which is what I am, is we look at things kind of from a holistic. We don't just talk about what the injury is. We look at what the contributing factors are, not only to help with the rehab, but also for injury prevention in the future. So I'd say if it was obviously an ACL injury, then go and see one of the knee surgeons, obviously. But if it's something that you kind of think it's an overuse, it's a niggle, you can't quite put your finger on it, then I would say the physicians are a good place to start.
That is that again. That's just everything's really interesting. But no, but that is really interesting. I mean, you're right. If it's a injury or a specific thing, see that specific surgeon or consultant. But if it's something that's more generic and you can't seem to understand it,
and I think it's great. And one of the reasons I love working here is we do cross refer, and that's because not all injuries need to be managed surgically, and vice versa. And we do a lot of the non-surgical, but we complement by helping prepare, for example, the individual, if they are going to go down a surgical route, to be better placed, whether that's through prehab, meaning you strengthen the muscles before you have an operation, or looking at all the components I've just talked about around sleep, nutrition, because surgeons want good outcomes. And so the best way you do that is you get your body in the best place possible. And so here we work very collaboratively on that to make sure that it is individualized, but it's also covering all bases, not just the actual injury.
And that's a really important note, because I remember between my 2 knee surgeries, my first knee surgery was to heal my meniscus tear, and then the second one was my ACL. But in the middle, I started to train less and less and less and less. And mentally I was switching off and checking out. And I turned to my physio and was like, why? What's the point? Why am I training? I'm going, under the knife again. Well, why am I doing this? What's the point? And I even was regressing in my rehab from the first one. And he just sat me down and he looked at me and he said, because you want to go into your ACL surgery as strong as you possibly can, because your recovery will be harder. And that switched something in my brain, and I suddenly started training again.
And I also think you've got to, and again, I've had multiple injuries, you still need to exercise. So one of the other reasons why we work closely with the surgeons is you've got a knee injury, great. You've got another leg, you've got arms, you've got core. We can get you exercising, because maintaining athleticism is so important for someone that wants to be active. And so when I write a rehab plan with the team that I work with in, the elite sports setting, we talk about stages of rehab. Stage 1, recovery. 2, the kind of range of movement, reloading. 3, kind of athleticism, 4, back to the sport. That's very basic. There's lots of different programs out there for stages 5 and 6. But stage 1 will always cover off what are the restrictions. So i.e., maybe you can't do certain things with that knee, but we can be stimulating the muscles with various devices. We can be kind of getting the other leg to train, because we know crossover training, you train that other leg, it helps the affected leg. We can keep your trunk control, we can do your upper body. And I think making sure people remain active is so important, but understanding the restrictions so they're not putting the actual injury at more risk.
So we've covered a lot today, a lot, from physiology and red S to fueling, sleep and recovery. But if there is one message you want women listening to take away, what would it be?
Don't normalise loss of your period. I think there's lots of reasons that are gynecological that need checking out, but don't normalise it, get it checked out.
And then what is one thing you want women to feel validated about?
I mean, like I said, I want this could go on forever on this one. It's probably not. I just feel like we should be deemed equal and we have the same opportunities. So I want them to feel valid, that they can go into the gym and train, not be fearful of that. And if that is getting confidence by seeing someone like myself or a physio to get that, that's so important, because being fearful of not being equal will just be widening that health inequality further on down the line. We need to stay active and healthy, and we need to find ways of making sure women feel comfortable in the gym or on the field of play or playing sport.
Yeah, just feeling comfortable, and also feeling comfortable in yourself.
Yeah.
And your body and who you
are. And
are.
Everybody's different. So how you train versus how I train. We talked about it before about our periods, your period will not be the same as mine. My period from when I was 20 to now is not the same. It's really important just to be love, this is an amazing thing. We are an instrument. We're not an ornament. We are very much there to be part of society. And I say, just like, look after yourselves.
Well, we're all unique. Every single one of us on this
Yeah.
planet, we're all unique in our own ways. And just because someone can do one thing differently to you,
Yeah.
find out a different way that you can do something.
Exactly. And I could go on for ages. There's so many differences, even just in one body's length to another. Why one person might find, a squat easier than a deadlift. Like, there's so many reasons, so don't beat yourself up. Let's find an alternative to keep you moving.
Well, what's interesting, just on that, I used to rock climb a lot.
Yeah.
I mean, I still do, but I used to rock climb a lot, and apparently I have a really big arm span. I
Oh,
do.
okay.
Yeah, but I don't look like I do, but apparently I do. But even that, I remember having a conversation with my cousin, and her arm span wasn't as big. And even that, how that affected just the way the two of us climbed.
Yeah, exactly. And so there's certain sports that lend more to other body types. And sometimes you go with that, sometimes you challenge it and see what you can still achieve.
I like that. Sometimes you go with it and sometimes you challenge it.
Yeah.
So thank you very much, Jo, for joining me today on Behind the Best, the podcast by Fortius Clinic. And if this conversation resonated with any of you today, then know that these experiences are extremely common. I've realized how common they are. And, it doesn't matter who you are. They are extremely common for all of us, and that a better understanding leads to much better outcomes. So thank you for listening, and don't forget to follow us, tune in for more stories and insights, because behind the best, there is always more for you to discover.